So we're talking about knee pain and ideally avoiding knee pain or treating knee pain. We get a lot of times where people will come in with knee pain, or they'll just generally ask, hey, what exercises should I do for my knee? And sure, there are all kinds of exercises that we can do that involve the flexion and extension of our knee. But a lot of recent research has actually looked at treating knee pain by going above and below, by fixing kind of our foot and our ankle and fixing our hip. We're gonna save the foot and the ankle for another video, but now we're gonna talk about how can I fix my knee pain by potentially doing more work with my hip. If we think about it, when I'm weight bearing, I need my knee to be in a nice stable position. Anything that allows my knee to rotate in and collapse in, I mean, this just doesn't look very stable. It doesn't look like it can bear weight very well in this position. But this is in large part determined by very small rotations of my hip. Just a couple of degrees of rotating my hip creates huge differences in the position of my knee, and same with my foot and ankle. Small changes in position of my foot and ankle create massive amounts of torque around my knee. So research has actually shown that people that focus more on core strengthening, aimed at kind of stabilizing our pelvis and getting our pelvis more neutral, and strengthening the muscles around the hips, specifically our glutes, actually get better resolution of knee pain than people that just focus on strengthening their quads or their hamstrings or their calves or the muscles that directly attach to the knee. So what does that mean? What does that look like? Well, when we see a lot of people do lower body exercises, we're gonna look at 3 different movement patterns. We can talk about deadlifting, squatting, and lunging. Those are kind of the 3 main things that my lower body does. A deadlift is basically just me picking something up from the floor. When I squat, a squat is just a simple way that I can get down into a seated position, and a lunge is a simple way for me to actually get to the ground. So lunging, or we can even think of a step up as kind of a version of a lunge. When I do any of those movements, my body is going to do what feels the easiest, or it's going to follow the path of least resistance. And we see with a lot of people, those movements can either be hip dominant or they can be knee dominant. So the person that squats, if I lead my squat by creating flexion of my knees, I am eccentrically lowering myself down into the squat. That's going to create a lot of stress on my knee. And the more you do that, the heavier weight you lift, or the more volume you do, or just the more times you get up and down out of a chair, that's probably going to start to create a little bit of stress on our knees. If I can create more hip dominant movements, then I got to know that I can adequately hinge from our hips or bend around our hips. One of the ways that we test this, we probably demonstrated this before, is if I take this stick and put it behind my back, so it's going to touch my tailbone, my spine between my shoulder blades and my head. There's going to be a little bit of space between my low back and the stick. We want that. That's supposed to be like that. And I want to see, can I actually bend from my hips without altering the shape of my spine? And what's going to happen is, and this may sound a little zen, but we're going to see that my knees are going to bend, but they're not really going to move. So I'm going to allow my knees to bend rather than try to bend my knees. So somebody who's knee dominant, as they try to move from their hips, we're going to see this early active flexion of their knees, as opposed to allowing my hips to do the flexion. And then as my hamstrings become tight, I'm letting my knees bend. I'm not thinking about bending my knees. So just going through that drill with a golf club or a broomstick or a dowel, or even if I don't have anything to put kind of on my spine, I can just take 2 hands and put one hand at the bottom of my rib cage, one hand at the top of my belt, and then see if I bend forward. Well, if my hands come together, I'm rounding my back, so I'm bending from my spine. If my hands get further apart, I'm arching my spine. But if my hands stay the same distance apart, then I'm bending from my hips. That's going to help give us that feedback as to whether I'm creating hip motion versus spine or knee movement. So even just practicing this a few times to get that feel of neutral spine rotating around my hips, again, we see that my knees bend, but my shins don't really move. I'm not creating a big angle at my shins. So that's how we're going to want to approach picking anything up from the ground, learning how to deadlift. I want to create that hip dominant posterior chain movement. When I squat, again, we look at the bottom of a squat. I should be able to, with my heels on the ground, get myself to a good depth. And we would say good depth would be kind of back of the thigh to my calf, whether that breaks parallel to the ground. I should be able to get kind of the bottom of my hams, the back of my hamstring to the bottom of my calf. Now, how I get down there is going to be important. Again, I can break with my knees first and get all the way down there, and I've loaded a pretty heavy demand on my knees, or I can hinge from my hips and use my hips to pull myself down and end up in the same position. So again, it's just like going on a trip. I can have a start and an end point to my destination, There's an infinite number of ways that I can get to that destination. Today, we want to focus on the one that's going to put the least amount of stress on my knees. So a simple way to conceptually think of this, again, there's a great line. Greg Rose, kind of the head of the TPI, has a line where he says, in an exercise, form only matters if it's bad. If we see somebody doing something, they're squatting with totally collapsed knees, clearly we got to stop that. But once someone's form looks okay, well, now the form's less important. Now what's more important is, well, what do you feel? What's actually happening as we do this? Because that bottom position of the 2 squats I demonstrated might look exactly the same. So now it becomes down to what my body feels. If we think of what the bottom of that squat looks like, I've flexed my thigh closer to my rib cage. Well, I can do that standing by pulling my thigh close to my rib cage. Now the right half of my body is kind of in that bottom position of the squat. And I've done it by using my hip flexors to pull my thigh to my body. I can do the same thing on the left side. I can use my hip flexors to pull my thigh to my body. Well, now if I did that same thing on both sides, I'm using my hip flexors to pull my thighs to my body. So I'm using my hips to pull myself down rather than using my knees to lower myself down. Now that may seem like we're splitting hairs, but the difference in terms of what somebody feels is dramatically different. We can feel that we load our hips as I pull myself down, as opposed to creating a ton of pressure around my knees. So if we can master that hip hinge and that hip dominant motion as I squat, that's going to take a lot of stress off our knees. And then the last thing we'll look at is kind of a variation of a lunge or a step up. If I'm going upstairs, now this is a very exaggerated kind of step, again, I need to make sure that I've got good stability at my arch and good control of my hip to make sure that I don't lose position of my knee. So a great way to practice that is to grip that ground with our foot, use our hip to drive ourselves up, and then be very conscious of pulling myself down in a way where we don't see my knee buckle in. And again, practicing this, a lot of people are going to find that they struggle a great deal at keeping their knee in a very kind of consistent position. When I demonstrate it from the side, somebody who's very knee dominant in their movement, as they start transferring their weight, we're going to see a very pronounced shift into the knee to load their quad as they lift up, as opposed to creating more torque from their hip to bring themselves up. Again, my knee is going to bend, but it's not going to move as much as if I load my quad to push myself up. And even demonstrating that doesn't feel very good on my knee. So if we can practice that hip hinge, better squat mechanics, and better lunge mechanics or step up mechanics, you're going to feel that you get a lot more work done through your hips. We're going to get stronger muscles around the hip and a lot less knee pain.